All right, Robyn, I look forward to this conversation because I'm a big fan, as you know, of the big picture. And as women are looking to prepare, it's like they almost have a checklist. I'm going to do my birth class. I'm going to go see the physio. I'm going to do my nursery. I don't know. I can see that they have a checklist, but sometimes I think it's hard to tie everything together, and how, your birth class should fit together with what the physio is talking to you about, and should fit together with some of the physical and mental preparation you're doing. And so I look forward to having this conversation with you so that I can share it with other women and people listening, so that we can kind of help connect all the dots for people. So let me tell everyone a little bit about how I know you, Robyn. As you know, I like to connect people, and I am always trying to kind of break down some of the silos in care that I feel exist, because I think collaboration is so important, and birthing people should feel that everyone's giving them some of the same cohesive messaging. And so as I was putting together some information, I remember reaching out to doulas across the province, just trying to let them know about some of the work that I do, and just trying to tie them into the process. And very few people ever get back to me when I message them, but you were one that did. And so since then, we've really gotten to know each other quite well throughout different projects. And so I value not only your collaborative attitude, but your positive attitude, and your willingness to share. And so I would love for you to start by introducing yourself, kind of a little bit about you, how you fit into the birth space. And then let's start talking about just, the benefits of being able to advocate for yourself in birth, and what that looks like. So tell us a little bit about yourself, Robyn.
Yeah, thanks, Melissa. And first, let me just say thank you so much for having me on the podcast. I really admire all the work that you do. So a bit about myself. I'm based in Revelstoke, British Columbia, a small town in the mountains. And I am a certified birth doula through DONA International. And I've been a birth doula, I think, for about 5 years. It's not my main profession. I'm a biologist, but on the side, I've taken to birth work, and I recently had a baby myself. Yeah, and I'm stoked to have the conversation about advocacy and what that looks like.
Because I think, when women first often come to an appointment or reach out online and say, I'd like to work with you, Mel, and I've heard that this can help my birth, I always explain first that, yes, I know that you attach me to the pelvic floor, but the pelvic floor is part of our whole body and is part of our, very much connected to our nervous system. And if we think of this, the big picture first, and just that when you go into birth, that there will be a fight or flight response. Like, that's what happens with the unknown, with discomfort, with people everywhere. And once we talk about the anatomy of the pelvic floor, and how the pelvic floor is the outlet for the baby in a vaginal birth, that makes sense that I wouldn't want to tighten those muscles when I have, when I'm actually pushing my baby out. I would want to learn how to let that exit be as easy as possible. Oh, I get it. I need to learn how to relax my pelvic floor. But my pelvic floor is related to my nervous system. And so really, if I can just learn to relax my body, and surrender to the process, it's not just about the pelvic floor, it's about something bigger. And then I think you start thinking about, well, how would I relax? Is there only one way to relax? Do I just have to visualize something? Is it something I need to say to myself? Is it a smell? Is it something someone else repeats to me? It can be anything, right? And I think that one of the topics we're going to cover today, and how that fits in, is how can I let people know what I want? Because no two people are the same. No two people will respond the same. And I think sometimes we don't know how to share what we want, or how to let people know what preferences we have. So, I appreciate your time on this. And I'm curious if you start by talking about first, Robyn, what kinds of differences do you see in the birthing process? What are two ends of the spectrum, maybe?
Yeah. And I, there's so many ways to prepare for pregnancy and childbirth. And so, like you say, there's people that come in and kind of have a checklist of seeing a pelvic floor physio and doing a childbirth course and all those things. But I like what you're saying, like the folks that can tie it all together and have a general sense of body relaxation and mental preparation for being able to adapt to changes. And that starts in pregnancy. And so folks that and before pregnancy, really, folks that have spent time on becoming self-aware of what's going on in their body and how to respond and to those changes in their body and in the external circumstances. So sometimes folks have done very little in terms of an actual checklist, but they seem really in tune with their body and knowing how to share what their wishes are with their folks around them. And they've talked about it with their partner, their doula, their care providers. And so, yeah, there's a sense I get of folks. I think you had a line from a labor delivery nurse, folks that just know how to be in tune with their body and going with their body. But I think it's also beyond just the body, just going with whatever the flow of whatever situation is. And in my prenatal class, there was a good line around going with like unforeseen, uncertain circumstances too. So there's just so much that we don't have control of in pregnancy and childbirth. And so folks that are ready to adapt and kind of resilient through those changes and can express and process emotions either like during or after. And I've got personal experience with that now as well. So yeah, in terms of advocacy and birth planning or birth preferences, I always say to folks, like, being able to have a general sense of your wishes, talking to your team about it, but then also having a plan A, B, C, D for when things go differently, and knowing how to process that in the moment or afterwards. It is where I've seen folks have the most success. I don't know if success is the right word to use, but
yeah, well, and I think because
most satisfaction.
Absolutely. I think that, and they've even started to, you're starting to hear about some of the research around how birth satisfaction is highest when people feel part of the process, right?
Totally.
And I'll say, even with my first birth, there wasn't social media. I feel my friends didn't talk too much about it. And I definitely went into it kind of being like, oh, I just show up and they'll tell me what to do. And I remember the sense, and I know a lot of women can relate to this. I just want to be easy. I want to go with the flow. They'll tell me what to do. They know much more than me. I don't want to be that difficult person with the star beside my name at shift change that they're like, oh, I don't want that lady. So I remember thinking like, I can't say I felt nervous about the birth, but I also felt pretty oblivious, but I didn't know that I was oblivious. And so then
that's a very common experience, Mel.
Yeah. And so that when things came up, I didn't know my options. And I remember coming out of that thinking like, yes, I have my baby. I'm very elated, but I could tell that there was different things I could do to prepare the next time. And so I think sometimes like women, they say they don't want to talk about the preparation mentally.
Maybe it's something about, if I don't know what's coming, then I don't have to and this is where I have the example of like, okay, you have an idea of what you want. Is there anything that you are worried about?
Yes.
Because if you think and talk about what you're worried about, if you're worried about cesarean or episiotomy or forceps, do you know like why those tools are being used and what they can do to prevent that? But also, if in the moment that there's something that changes, just being able to process that you did do your best, you're not a failure should something not go to as planned. Because I think there's I don't know, there can be some negative talk out there around how birth should look like.
Yes.
In terms of like natural childbirth, that being the only way. And there are so many ways to give birth. And so I really coach folks that you have your birth preferences, you have the things that you are hoping for. And sometimes you don't know what those birth preferences are until you're in the moment. And or something changes and you're like, dang, I really really wanted this thing to happen and it's not happening. And so it's also important to make space for emotions in the process, in pregnancy, in childbirth, in postpartum, when things don't go to plan, and knowing that, yeah, that it's all so uncertain. And so having a support team to be there for you when things don't go to plan, I mean.
I often tell my clients, and I'm pretty sure I've talked about it on the podcast before, I find our culture a bit guilty of that. It's kind of like shoot for the stars and just plan for perfect.
Yeah.
And then, this is something we just don't have a lot of control over. And so when it doesn't go as planned, it can be very shocking. And for some people really be a letdown. And yeah, I must have done something wrong. But I think sometimes, I know other cultures do a better job of planning for anything, like allowing your brain to go to what you would consider worst case scenario, whether it be,
Totally.
Instrumented birth, episiotomy, C-section, like whatever you think your worst case scenario it is, play that out. And because if it happens, you're prepared for it. Right.
I agree. And I have a little tool that I can share. It's pretty commonly used in the doula world, so that when you are faced with something unexpected, often I find this starts in pregnancy because stuff comes up in pregnancy. And there's an acronym called BRAIN. And so that stands for benefits, risks, alternatives, intuition, and never, or no, not now. So the way you work through that is, say something comes up in, like I said, in pregnancy or in childbirth. If there's time, if it's not an emergency, being able to ask the questions of your doula or your doctor or whoever's in the room. Okay, what are the benefits of this episiotomy? What are the risks? And if you start those conversations about benefits, risks, alternatives, what your intuition's telling you, if you can choose to not do it or do it later, delay it. If you can have those conversations outside of the birth room, like before childbirth happens, then you'll thinking through what those worst case scenarios are and asking those questions means that you have a greater sense of informed consent and informed understanding of what was happening in your body and how the care providers are helping you in childbirth. Because if all these things hit you unexpectedly, and some things will hit you unexpectedly in the time, but if you've done more of that thinking about what a scenario could look like in advance, then you'll be able to kind of go with the flow, because you'll have done that thinking about benefits and risks, and you will have emotions, absolutely, for sure, still about something. But I feel like then you don't have all those questions of like in the moment of like, did I choose the right thing? Because people are often surprised that there still are choices that come up in pregnancy and in childbirth. And I am all about informed choice and informed consent. I think that is definitely increased satisfaction in clients if I feel like they have the resources and the understanding for why certain things happen. And as a doula, often what I'm doing is providing them with the resources for them to make their own decisions, so they can come from a place of like, oh yeah, okay, and now I understand what group B strep is all about and why I'm getting this extra antibiotics and how I can plan for that so that my birth can go smoother. It's birth is full of lots of unexpected twists and turns. And you can't be 100% prepared.
Well, and I think sometimes we show up for appointments just assuming like, okay, at appointment this, my care provider will talk about this. At appointment the 30, they'll talk about this. There's not 30 appointments, but I just made that number up. But
there's a lot though.
There's a lot. But basically that I think we expect all that information will be laid out to us.
Yeah.
But sometimes it's hard. I see as someone that sees a lot of pregnant women, I don't want to overload them with information either. So I love when they come to the appointment saying, these are my questions, because then I know I can tailor the appointment to what their needs are. I don't, otherwise I think, I get that some women coming in are just like, oh, I'm here to go with the flow. I'm here, you're the expert on this, Mel, but I'm like, but I'm not an expert in your body. In
your body. Exactly.
Yeah. I know a lot of things that I think would be helpful, but I can't tell you what's helpful or what's, interesting to you. So I think sometimes like you're right, kind of listening to these things that you're probably hearing others talk about, but jot them down and think them through. Do I have questions about them? And maybe it's a matter of taking them into your care provider to ask
Mhm.
questions.
And it might be as simple as like, what is my body telling me about this? Like when you go to a doctor's appointment and something gets talked about, are you feeling nervous in your body? Are you anxious about something in particular? Um, can you, if something is a bit stressful in pregnancy, is there some breathing practices? And you've been great at sharing like different ways, mindfulness and breathing, and how that connects to your pelvic floor. Um, Practicing that in pregnancy is setting you up for success in childbirth and postpartum recovery, and having um, tuning into the like brain response, obviously, of like, what am I scared about, but also like your body response, because sometimes your body is telling you something before your brain does.
Mm-hmm.
So yeah, folks that I see you'll have a lot of success have practiced managing that stress or discomfort, and tuned into their body as well.
Well, that's something that if you would have told me when I was first pregnant, practice meditation and mindfulness and practice managing stress, I would have kind of rolled my eyes at you, I'll be honest with you. But I think that's what I've definitely learned along the way, is that, there's so much about birth that it is natural, but we fight our natural responses too. I mean, and so learning to be able to take something that is expected to be uncomfortable and expected to be stressful, but try to instead of fighting that, learn to work with it. And that can take some practice, and I think
Oh,
that
totally. Yeah.
people, when you tell that to people, they're like, well, that makes sense. Like, that makes sense that I need to just relax. But when you really kind of think about it, that's not easy. That takes practice. And so
It does.
I
Yeah.
think that is something, if I ever had another baby, which I won't, but in my mind, if I ever had another baby, I would spend a lot of time just, more meditation, more mindfulness. And sometimes I tell people, just take your day-to-day stresses and practice relaxing
Yeah,
those as
totally.
a preparation for birth. Because again, if the overall goal is to be able to take something uncomfortable and intuitively creates tension, but create relaxation, that's the benefit of practice. And
Mhm.
and um, you know, taking away some of the unknowns. You don't know how it's going to go, but you can research some of this,
Yeah.
all my options that might come up to me. I can understand them and evaluate them before, so that in the moment I can stay calm. Correct? Instead of,
Exactly. Yeah.
I have anxiety about this new thing that I've never heard of and I didn't know to expect that. But I
Mhm.
think too, so thinking, okay, well, I get that I need to work with my own body or my own mind and my own nervous system to be able to practice creating calm. But then what about, because obviously this is where there's also research that says that birth outcomes, um, you know, are often dictated kind of by where your birth is and who your provider is, which I think, when you think about that, it goes to show that it again creates comfort. It creates, I can
Yeah.
relax. I feel safe. I feel supported in my
100%.
surroundings.
Yep.
So then can we talk about that? Because obviously that's where doulas fit in, is not only, okay, who am I going to be surrounded by? Where am I going to go for my birth? Is it going to be at home? Is it going to be in the hospital? Is it at a birthing suite? And
Mhm.
what kinds of things do I need to consider at my location? But then who's going to be there? Is it my partner? Is it a doula? Is it my mom? Can you talk about
Mhm.
all that a bit?
Yeah, and that's where I say there's no right or wrong. Everybody's got a different preference for where they're going to be most comfortable. Some clients say 100% I need to be at the hospital where there's all these different things available to me. Other folks would say I want to be at home. That's my comfort space. So there's not a right or wrong on, and same thing, doctor versus midwife and doula or no doula. I am just a fan of saying what is going to make you feel relaxed, supported, like like you have, the best chances of success. Like what is going to feel best to you. Um, and sometimes, yeah, you won't know till the moment of like, oh dang, I do feel differently. I want this thing. And so I always say interview doulas and doctors and midwives and get a sense, like don't just blindly go into this because it is a really big life experience. think about it. Think about where you want to be and who you want to support you, and have conversations with your partner about how they can support you. Because even though your partner knows you really well and is maybe a very good emotional support in lots of ways, seeing you go through something as monumental as birth will be challenging for them. So talking to them about how they can feel supported. So as a doula might not just be for you, it might be helping your partner through the experience quite a bit as well. I know for my partner, he said, wow, the doula was so fantastic because it meant I didn't have to ask you all these questions. We had someone else that we could talk to and give us resources through pregnancy and birth and postpartum. So yeah, do the interviews, talk to lots of folks. And I always kind of imagine it like where you're running a marathon through pregnancy, childbirth, postpartum. You've got this big life event going on, and you need people to cheer you on and support you through it. And so, yeah, who do you want providing snacks and water along the way and telling you encouraging things if that's what is going to work for you, and have those conversations about how they can best support you. Because doctors and midwives and doulas see lots of different people, and some folks want different things. And so it's really like, you're not being difficult if you're sharing the type of support that you like to receive. So if you're somebody that's going to likely want a really quiet room, or want a lot of coaching and encouragement in a certain way, or like hands-on touch, and your partner needs some instruction on how to provide hands-on touch, that's something that a doula provides, is helping them with physical sort of touch and support in that way during childbirth. So yeah, there's lots of ways in which you can receive support, and also asking these different care providers, how would you describe yourself as a care provider? What's your you can always ask questions like, what's your rate of episiotomy, and like technical things like that. But I often find that you just kind of get a sense of somebody, and as soon as you meet somebody, this is somebody that I would feel calm and relaxed around. And I've had clients say that to me, oh, I knew right away. and I had a sense right away of who I wanted in my room, right? And you have a gut feeling about who feels like the right people to have around.
Totally. And I
And
think
same with postpartum, if you want your in-laws there or not,
Yes, absolutely. And I think that's like a perfect kind of explanation of how this is so much bigger than just how many Kegels or pelvic floor relaxation exercises you do. Is that, like, at the end of the day, the surroundings help your nervous system relax, and that will be helpful 100%. For baby's exit in a vaginal birth. So I think, again, just tying in, like, this is something bigger than just your pelvic floor muscles. And I think that's why I love having these bigger conversations, because sometimes don't get stuck in the nitty gritty. Like, look at
totally.
What
and it all ties together.
It all ties together. And then I thought it interesting. I know that there's also a lot of evidence to support having a doula, and just, again, what are your preferences? But like, and obviously, like, I'm looking at one here. This was a big, I might get some of my resources mixed up here, but basically that just continuous support, which I know can come from different people. But when you think of continuous support, sure, it can be your partner. But if the partner, like you said, they've never done this before, I think it'd be really hard to be able to kind of jump in there and be able to give you everything you need when this is new for them. But even you look at nurses, like, I remember thinking very highly of my nurses, but they often have more than one birthing person at the same time, or they have to spell each other off for breaks. And I was really surprised, actually, to see there was even a study in Canada that I think it was up to 50 to 75% of the time of nurses is spent outside the birthing person's room.
Yeah. And the studies on doulas that I've seen, you have, like you say, the continuous support of a doula is quite different than a nurse or a partner or a doctor. So a doula, I heard described by a fellow doula as, a doula knows birth and your partner knows you, and together you make a team. And what's different about a doula as well is that the nurses you meet on the day, they, like you say, they have 12-hour shifts, they come and go, they've got a lot of paperwork to do. Some of them can be really hands-on and be just the support you need, but there might be different personalities coming in and out. And so a doula is somebody that you've chosen in advance, who's going to be there continually through your birth, from at least active labor, sometimes before active labor. And they've met you a few times before the birth to get to know your preferences and to ask you a lot of questions to help you figure out what you want. So, because it's all unknown, you don't know the questions that are the things that might arise. So a doula can help probe into that and provide you options of what different scenarios can come up. So that continuous support, look, it is different. And I often find that it's for the birth person, but it's also the partner, because like you say, the partner has never gone through it before. And so having a doula there to help your partner means your partner can feel more assured of like what's normal really is what it comes down to. Partners often look to me like, is this normal? Yep, we're just in transition. This is great. She's doing great. She's doing all the right signs. You're doing great at supporting her. Just having the assurance for the partner then calms them, to that, which then will calm you as the birthing person. So it all is connected, and I see it all as a team too. So we're all working together. It's nobody's against anyone. We're all part of the care team. And I love, as a physio, you've come into this because the connection, like you say, to the pelvic floor and so many other parts of the body comes into the birth practice of doulas in terms of connecting to breath and relaxing the body too. So
yeah, and I think I see myself as someone that helps people learn about their physical and mental body and how they're connected. I don't think anybody else in the birthing space learns as much about the mom's body.
Yeah,
right.
Yeah, totally.
Like
you are so connected to that.
The physical body.
Yeah.
But I don't mean myself. I mean like physios in general. Like that's kind of our expertise.
Yeah.
But that at the end of the day, I look at, for example, some of this research on doulas and look at basically people that had doulas. They saw that they had increased mobility, they had decreased pain levels, decreased anxiety, decreased use of epidurals, decreased use of interventions, shorter labor, higher satisfaction, higher rate of vaginal birth. And so I look at that, and I get that you don't have a magic wand, but I look at that and think that's all helping someone relax. And that's all helping 100%. Someone facilitate their body. And again, I didn't have a doula. I don't think I understood enough about what that offering was, but I can see that it's someone there to help you feel confident in your body, right? And in the process.
Yeah, absolutely. And who wouldn't want all those things? But at the same time, there are some people that they're going to feel good with or without a doula, right? So it's not like it's a must-have for everyone, but there's so many benefits when you look at the research. And some people, they were recommended to have a doula, and they didn't really understand what it was all about. And it was afterwards that they said to me, "Oh my gosh, I didn't realize how you were going to support me, like how much this would help." And same with the partners. They went, "Wow, like I couldn't have done this alone." I'm so glad, because birth can be long. It's a marathon for some folks. And so when you have somebody that you can call over the course of early labor, it's like you can be days in early labor, and it's having somebody that can reassure you through that process.
Well, and that's the thing,
adapt to changing scenarios. If you have to go in for surgery and you weren't expecting it, helping manage all those different things.
Yeah.
And like you say, that doula is that person throughout it.
Well, exactly. But if someone chooses not to, and I think, again, the top of coming back to kind of, well, what are we even talking about? We're talking about how to advocate for yourself and let people know your choices and your preferences. So if you don't have a doula, the importance of being able to talk to your partner or whoever's attending with you, because you can see the benefits of this continued support. And I remember actually walking into my birth and always thinking like, I need to make friends with my nurse. Like that's all I need to do. I just need to make friends with my nurse, because I brought in Starbucks cards, and I was just like, if I can make a relationship with this person, like I don't think I understood why I was doing that, but I can see like I was trying to feel confident, and I felt if I can just connect with someone, then I'll be okay. If I will trust them, if I can make a relationship with them. Yeah.
That's exactly right. And I think the people that I see that don't have doulas, but have had really great care support from doctors, midwives, nurses, you can get that same amount, or not same amount, but you can get some continuous support from those other members of the care team or maybe you have a friend or a mother or a sister or somebody that's also going to be there to help spell your partner off, or maybe you're doing it without a partner, but you have other types of support that feels good to you. I think there's no black and white of like, this
No.
is how it's supposed to look. Everybody's going to be a little different. But I
Yeah.
love that you brought Starbucks gift cards. I mean,
Yeah.
someone else I think was saying like, yeah, they went into their birth with a sense of humor and tried to connect with the people in the room. And that's where I really, I say advocacy starts in pregnancy too, because if you can connect to your care team and feel that confidence and trust in your team, and they know you, and the little bits that you get to see all of them in appointments, finding ways to connect with your team means they can kind of get a sense of you as well. And if the more confidence you're showing there during your birth, then the more confidence they're going to have in you and trying different things if something is going
Well,
not to plan too. So
and I think we're so quick to be like, oh, well, okay, I'm hear what they're saying. They're saying that the care provider and the location is what's going to dictate my outcomes. Yeah, but you need to do like, this does not fall all on the location and the birth team. Like you're part of this too. Like you're
part of the team. Yeah.
You are part of the team and it's your body. Like birth doesn't happen to you, it happens with you. So what are you going to do to make that environment conducive? What are you going to do to help that team? Like I think that part of that's on us as the birthing person too, is not, we're not throwing it all at somebody else. And I'm curious then, given all of this work that you do with other people, I want to hear a little bit about your experience and some of the things what did you take out of your preparation and birth?
Yeah, absolutely. I'd love to share my experience. I think I'll preface this with saying, I'm cautious too when I share experiences, or when people share experiences with me. Everybody's experience is going to be a little different, right? So I went into this knowing a lot about birth as a birth doula, but also having no clue what it was going to feel like being pregnant, having no clue in my body, and having no clue what my birth was going to look like. So there was still a measure of uncertainty. And I did have like a checklist of sorts in terms of like, I wanted to find ways to connect to my body and manage that uncertainty. And so doing a course with my partner so that we could feel connected and build that sort of shared understanding of what birth might look like and how we wanted our scenario to look like in general, right? Preferences in terms of like how I might manage the stress and how he might support me. I did have a doula. I had a good friend who's a longtime kind of friend and doula mentor to me. So I was really lucky in that. And then I also had an amazing care team in Revelstoke. And so I was set up in a lot of ways, like informationally and support. I had a lot going for me. I was feeling really good in pregnancy. I did Mel's inside out pregnancy preparation as well, and the group pelvic floor and other kind of preparations for the body, and mental preparations and breathing and all the rest, and visualization. I did tons of stuff. And then when it came down to it at 37 weeks, I had COVID. And so I had to go in for an extra ultrasound. But, I was lucky that we did, because at 37 weeks, I found out that my baby was breech, which spurred a whole bunch of emotion and different doctor's visits to see if we could flip the baby, and conversations around trial of vaginal breech birth in Vernon or a cesarean surgery in Revelstoke with my care team. And, I had to still do some of my own processing and to reach out to my support team and have a lot of conversations to learn about what my options were. I kind of knew the information, but still in the moment, I had to do my own processing and really look at it all in the moment, because in the moment things can change, right? So it was amazing. I feel like that process helped me understand a little bit of what it's like for some of my clients when the unexpected hits them, and it can hit you in pregnancy, or in the birth itself, or in postpartum, something can come up. And I just felt so lucky that I had the tools to, I amazing care providers to talk to and a support team of doula and my partner and folks that could kind of support the emotional aspect of kind of going through that. And then preparing for a cesarean surgery, which was ultimately our choice, was incredible as well, because I had done so much thinking and preparing about vaginal birth. And while I knew a lot of information about cesarean, I still had to do some of that preparation myself in a moment, and advocacy with my doctors about how I wanted that surgery to look. And ultimately, they just came right on board. I had a team that was like, yes, we want to make this happen for you. Yes, we want to make all these things happen. And some of it was normal, but it was still good to talk about it and say, I want skin to skin as soon as possible. I want to have a vaginal seating of the baby. I want our own music being played. I want photos. I wasn't able to see the birth, but my partner was able to stand up and see the birth. You know, there's a lot of things that I was able to advocate for still with a cesarean. And my doula helped me, come up with ideas of things that I might want, and also just really supported me in doing that processing. And ultimately, I feel so grateful for the birth I had. It was all like, I had done the work of processing it all, and I had done the advocacy for the wishes I had, and nothing ever goes exactly to plan. But in the moment, I was there in my body. I walked into the OR, which I got to say is a really powerful experience, to walk into an operating room and saying, cut me open so I can have my baby. Like, oh boy, is that ever a powerful thing for some moms to do. I know it's not everyone's birth, but getting to experience that, I felt, real confidence and trust in my team, right? And in myself. And then lying down on the operating table as they were putting, all the drugs into me, I was doing all the breathing work that I coach my clients on. And I was sitting there going like, yeah, this works. I can do this. I had a high blood pressure, and they sort of said, oh, is everything okay? And I'm like, it's going to be stressful. It's normal that it's stressful. And I'm doing the breath work that I can to manage it, but it's okay that my body is going into fight or flight right now. Like, what can I do to calm it? But that's okay. Like, just knowing that those body responses were still going to happen. And then I got to say, that baby being placed skin to skin on me, well, as soon as he came out screaming, I was like, yes, we're okay. I have a screaming baby. He's alive and good. But as soon as he was placed on me skin to skin, it was like the most blissed out experience I've ever had. And so if I can create experiences for my moms of having that experience of having your baby being placed on you and having it be the best feeling in the world, whether that happens right at birth or later in postpartum, where you have a time that you connect to your baby, those experiences are irreplaceable. And just like, I always say to people, like, it was so blissed out, and I don't do drugs, but it was probably the highest high that I've ever experienced.
Oh.
And I wish that for everyone, right? And so what can you do to be in the moment to experience those things in life? And it might be at the birth or later that you feel that connected to your baby, but I think the work beforehand of connecting to my body, having a great support team, advocating for the things I wanted in my birth, having my partner on board and understanding what it was going to look like and how to support me. Really, I feel really grateful for all that experience.
You've talked a lot about some of the great things that the team in Revelstoke is doing. Can you speak to a few of them? Do you know?
Yeah, we have an amazing team. And I think part of it is that they're just really plugged into like, what's the research? What's the best thing that we can be doing and providing? And then they've also done surveys of mothers in Revelstoke to ask them, what do they want? And what can they be doing differently? And so even after my cesarean surgery, I got sent a survey. How was that experience for you? What could be done differently? And honestly, like some of there were some advice that I, got from from friends and courses around cesarean recovery that I learned a lot about and was able to share back to the team. And they're just really receptive to new information, I feel like, and making changes. And Yeah, I think that's the biggest thing about the Revelstoke team is that they're always open to new ideas and making changes, and having the sort of best case scenario for for mothers there.
Well, and
And
I
there's
think
a shared team, so there's doctors and a midwife that share a practice.
it's at the end of the day, I never want to be kind of saying like, okay, this is wrong. We're doing things wrong. But I think just like trying to encourage like lifelong learning and like always trying to make improvements and kind of listen to these people that are having babies and yeah, how is the experience, and can I guarantee I'm going to be able to make it all exactly how you want it? No, but I'm listening to you, and
Yeah,
you know,
yeah.
I'm going to try to keep up to date with what not only are people asking for, but what is the
Mm-hmm.
best practice based on evidence, and that's why
Totally.
the evidence is there. Well,
Yeah.
Robyn, thank you so much for your time. I know that you like little George did an amazing job sleeping while
I
we
know.
had this conversation. And I just want to say I've always appreciated not only for just the fact that you got back to me when I sent a message. I think it speaks volumes to how much you're willing to expand your practice and work as part of the team in your community, but outside of your community to make this experience as best you can for other people. But you've not only been a part of the pregnancy group I run, but the postpartum group, and you have no idea how much value you bring just in your willingness to share and your willingness to be open, because it always drives so much more conversation and draws out thoughts and experiences from other people. And at the end of the day, that's important. So thank you for not only this time, but for all the sharing that you do.
Oh, thanks, Mel, for making these opportunities possible for women and for folks to learn and grow themselves. I think you are doing amazing work for so many people.